In line with Community of Respect and Equality Alliance, in 2021 and 2022, Women Health Grampians undertook research into the experience of inequalities by women from migrant and refugee background in Grampian region during the COVID-19 pandemic, with focusing on impacts of mental health and well-being. Women from non-English speaking background experience higher rates of poor mental health compared with Australian-born women. The COVID pandemic has had a higher impact on migrant and refugee women's mental health as it increased existing barriers and discrimination to seeking help. Women's Health Grampian interviewed 20 women from migrant and refugee background who said, COVID-19 has an impact on me because everything is hard, especially when I go to see the doctor. There is someone at door asking me lots of questions and I don't understand English. I came to Australia 5 years ago. COVID-19 has changed everything. For example, no English language classes, so I can't go to learn the language. 90% of migrant and refugee women said that they experienced multiple hardship as a result of COVID-19 pandemic, including mental health stress. There were many contributing factors to increase mental health stress, and participants in the research shared their experience of self-care and seeking support. I feel during COVID times, everything was moved to phone or online, which I feel was very challenging to get services, especially when you have kids around you. When I need some support for my well-being, I cleaned my house and called my friends to make me think in a different way and how I'm interacting with my thoughts. The COVID-19 pandemic has increased the difficulty and barriers for migrant and refugee women accessing health services. I was initially linked with new parents group, then COVID happened. We tried to keep it online, but it was very hard. I decided to fall through this. I was referred to a social worker, but online appointments were not good for me. I decided not to continue my appointments. Service providers in Grampian region can learn from these lived experience and reflect on ways to ensure services are culturally safe, accessible, and inclusive for migrant and refugee women. Further information on this research report can be found on Women Health Grampians website, which is www.whg.org.au.